The season for getting sick, and with more snowbirds flocking here, Mesa Fire and Medical taking action. ABC 15's Ashley Thompson explains the new program treating you at home.
Kim, emergency rooms usually flooded with people who have the flu around this time of year. Mesa emergency officials using these trucks to treat people at their home. Feeling ill? You may call 911 thinking it's an emergency. If you're living in Mesa this winter, this team of dispatchers will be on the other line, helping you decide if you really need to go to the emergency room.
Right in a time when the flu is actually starting to increase.
Gary Smith is the medical director for Mesa Fire and Medical. He says the program gives callers access to mid-level or advanced level providers.
A registered nurse is able to provide additional medical advice.
Veda Rohr is one of those nurses working in the new triage unit. She says if she can't help the caller over the phone, she'll dispatch what's called a community care unit,
which is staffed with a nurse practitioner or a physician's assistant and a paramedic captain who can go ahead and provide them with some additional assessment.
The nurse triage unit, brought on just 4 months ago, is seeing its first flu season and its first round of winter visitors.
It gives another resource for our winter visitors to be able to have access to some sort of personalized health care before they get a chance to see their existing PCP or before they get a chance to establish a new primary care physician while they're out here.
The best part? The service is completely free. Mesa Fire and Medical received a $12.5 million grant from the Center for Medicare and Medicaid Services to help fund the program. Smith believes the service benefits all parties.
We're going to see an increased access to health care. We're going to see an improved type of health care delivery at a reduced cost.
And this new program will be in place for at least 2 more years. In Mesa, Ashley Thompson, ABC 15.
Ashley, thanks. And Mesa emergency responders first brainstormed this program about 6 years ago when there was a flu pandemic. They did not, however, have the money to implement it back then.